Welcome to The Explainer. Today, we're opening up the medical toolkit for mood disorders. We're going to look at the incredible science behind some of the most common medications out there and really get a handle on how they work inside the brain. 14.8 million. That's a huge number, right? That's how many Americans are affected by major depression, making it the most common mental illness in the country. But here's what's even more staggering. Less than half of those people actually seek treatment, and a lot of that comes down to stigma or just not knowing where to begin.
So, for those who do seek help, how do these medications work their magic? To really get that, we need to go deeper than the pharmacy counter and look at the amazing, complex chemistry happening inside our own heads.
Okay, let's dive in. Here's our game plan. First, we'll get into the biology of depression. Then, we'll explore the 5 main types of tools in what I'm calling the antidepressant toolkit. We'll, of course, cover the side effects and risks, super important. Then we'll look at a really specialized tool, lithium. And we'll wrap it all up with the most critical piece of the puzzle, your role in making treatment work. So, first things first, let's figure out what problem these meds are even trying to solve. What is actually going on inside the brain when someone is experiencing a depressive episode?
Now, major depression is complex. So many things can play a role, from your genes to major life events. But a really big biological theory points to an imbalance of the brain's chemical messengers. You've probably heard of them. They're called neurotransmitters.
Right, so think of neurotransmitters like serotonin and norepinephrine as tiny couriers. They're constantly zipping between nerve cells, carrying messages that control our mood, our sleep, even our ability to focus. Now, this theory suggests that when you don't have enough of these couriers on the job, the whole communication system starts to sputter, and that can lead to the symptoms of depression. So the main goal for most antidepressants, get more of those messengers back to work.
Okay, so if the problem is a shortage of these chemical messengers, how do we fix it? Well, this is where the toolkit comes in. Doctors have about 5 major classes of antidepressants, and each one has a slightly different way of tackling the problem. Let's open it up and take a look.
First up, we've got the classics. Tricyclic antidepressants, or TCAs. These were developed way back in the 1950s. They basically work by telling nerve cells to stop vacuuming up serotonin and norepinephrine so quickly. By doing that, they leave more of those messengers hanging around in the space between the cells. That's called the synapse, which helps boost communication.
Next in the kit, we have the MAOIs, and they use a totally different tactic. They go after an enzyme called monoamine oxidase. Just think of this enzyme as the brain's cleanup crew. Its job is to get rid of neurotransmitters after they've done their work. Well, MAOIs tell that cleanup crew to take a break, which keeps more messengers like norepinephrine and serotonin active for longer.
But, and this is a really big but, this powerful approach comes with a serious warning. MAOIs can have a really dangerous interaction with something called tyramine. It's found in a lot of everyday foods, like aged cheese, red wine, and cured meats. If you eat these while on an MAOI, your blood pressure can spike to life-threatening levels. It's called a hypertensive crisis, and it's exactly why these drugs aren't usually the first choice anymore.
And that brings us to the tool you've probably heard of, the most commonly prescribed ones today, SSRIs, or selective serotonin reuptake inhibitors. The name says it all, really. They're specialists. Instead of messing with a bunch of different neurotransmitters, they focus almost entirely on stopping the reuptake of just serotonin. That laser focus generally means fewer side effects than the older drugs.
Then you've got the SNRIs. You can kind of think of these as a modern, more refined version of the old TCAs. They also block the reuptake of both serotonin and norepinephrine, but they do it in a more targeted way. This can lead to a different set of side effects, and they can be really helpful for people who might not have had luck with SSRIs. And finally, we have let's call it the miscellaneous drawer of the toolkit, the atypical antidepressants. This is basically a catch-all category for drugs that don't fit neatly anywhere else. They all have their own unique ways of working, affecting different combos of serotonin, norepinephrine, and even dopamine. This just gives doctors more specialized options to find the right fit for a patient.
Of course, no medication is perfect, right? Every single tool in this kit comes with a detailed user manual, and understanding the possible side effects is absolutely essential for using them safely and effectively.
So while the side effects are different depending on the class of drug, these are some of the common ones you see. Things like dizziness, dry mouth, changes in sleep, maybe some nausea. But there's a much more serious risk to know about. All antidepressants carry a warning about a potential increase in suicidal thoughts, especially in younger people and right at the beginning of treatment. This is a super critical window of time, before the drug's positive effects have really kicked in, and it's why close monitoring by doctors and loved ones is just so important. Now, this toolkit isn't just for depression. Let's switch gears and talk about a very different kind of tool for a very different condition. Lithium isn't really an antidepressant. It's a mood stabilizer. In fact, it's the classic go-to treatment for bipolar disorder, helping to manage those extreme shifts between mania and depression.
Lithium has this really powerful calming effect on the brain. Sometimes it's even called an anti-mania drug. We're still studying exactly how it works, but we know it changes how ions are transported in nerve and muscle cells. This basically helps to dial down the hyperactivity and racing thoughts that are so typical of a manic episode.
But here's the most important thing you need to know about lithium. Getting the dose exactly right is everything. The therapeutic window, that sweet spot where it works without being harmful, is incredibly narrow. You can see it here. A little too low, and it does nothing. But just a little too high, and it can become toxic, even dangerous. It's a real balancing act that needs constant, careful management.
Because of that tiny window, living with lithium really is a partnership between you and your doctor. It means keeping your fluid and salt intake steady, because getting dehydrated can throw your levels off. It means avoiding common painkillers like ibuprofen, which can actually make your lithium levels go up. And most of all, it means getting regular blood tests to make sure you're staying safely in that therapeutic zone.
And this brings us to what might be the biggest takeaway of this whole explainer, and it applies to all of these medications. Treatment is not something that just happens to you. Whether we're talking about an antidepressant or a mood stabilizer, you, the patient, are the most important member of your own care team.
Success really boils down to these 4 things. Step 1, observe and report. Just pay attention to how you feel, the good, the bad, the weird, and tell your doctor. 2, communicate. Be an open book about your health history and anything else you're taking, even supplements. 3, stick to the plan. These meds can take weeks to start working, and stopping them suddenly is a bad idea, so consistency is key. And finally, number 4, go to your follow-ups. Those regular check-ins are where the magic happens, allowing for tweaks and adjustments to get things just right.
So, we've taken a tour of the current medical toolkit for mood disorders. It's a collection of powerful, but pretty complex, chemical keys designed to unlock the brain. And that leaves us with one last question to chew on. As our maps of the brain get more and more detailed, what's next? Will the future be all about even more precise chemistry? Or are we on the verge of discovering completely new ways to find mental wellness?